Hello, this video is to discuss the skill of IV infusion. To begin with, we always want to verify the order prior to beginning. Once we've secured our IV site, we then can begin our IV fluids as ordered. We'll want to enter the room and introduce ourselves to the patient. We also want to identify our patient using two forms of identifiers. When starting IV fluids, we'll need a normal saline flush. We need our clean gloves. We need alcohol prep pads. We need our IV infusion set. We need our ordered fluids. And then if we are supposed to also hang a secondary, we'll need our secondary IV set and our ordered medication for the secondary. And we'll want to inform the patient of the procedure prior to beginning. We'll want to go ahead and verify IV placement and ensure that our IV is still working well and that there are no issues. So we'll take our alcohol pad. After we have washed our hands, put on our clean gloves, we're going to cleanse the hub, scrub the hub for 15 to 20 seconds, and then we can place on our normal saline, open our clamp, and we'll want to pull back slowly, ensure that we still have blood flow, and we do. Then we can go ahead and flush that site well, ensure there's no redness or swelling or irritation at the site, and then we'll go ahead and clamp that back off, and we can remove our normal saline, and we can toss that. We'll get our IV infusion set, and we'll open this. And we'll want to maintain sterility at the end of our tubing here. So we won't remove this cap until we're ready to insert. Ensure that all of your clamps are closed so that your fluid doesn't escape while you're putting that in the port. So we've got our medication, we've scanned that, we've verified that, ensured that we have the correct IV fluids. We'll remove our ending, remove the cap to this, and then we'll insert that into the IV fluid bag. You'll want to have possibly a trash can in case it does start to overflow. You can let that flow into the can. Now we'll go ahead and open our clip, and we're going to allow, we can squeeze this tubing to get that to go a little faster, and we're going to allow our tubing to fill completely. You want to ensure you get all of the bubbles out of it. And once you have that done, your tubing is primed and you are ready to place this onto your patient's IV. We'll take another alcohol pad. And again, we're going to scrub the hub for 15 to 20 seconds. Once that's done, we can remove the top of our IV fluids, the cap, and we'll insert that. And now you have that connected to your patient. If needed, you can take that a little better if it is unsecure. We'll take our little blue IV pole clip, and you can insert that in the top of this IV infusion kit. On your IV pole and your IV infusion set, you have numbers, so you'll slowly insert the blue clip into the top, just as I did there. And then you'll do your 1, 2, 3, and 4. Once these are all green, you can close your door. And once that's closed, you'll remove your blue clip. And then we'll want to type in IV, and then your IV maintenance fluids will pop up. So this is normal saline, so we can go with just regular IV maintenance fluids. We'll hit OK. And we'll say our order is set at 100 milliliters per hour. You'll want to go ahead and type in your 100. OK. This is a 1,000 ml bag. However, you're going to want this to alarm you when it's getting low. So I typically set this for about 950 so that it'll alarm you when you have time to go ahead and change that bag. And then you're going to hit OK again. And we're going to ensure that our tubing is open. And then we're going to hit run. Make sure all our clamps are open again. And then we're going to hit yes. Now our primary bag is infusing.